Do you have neck or back pain? And are you concerned that you have a pinched nerve? Don't worry, you're not alone. We see that a lot at our clinic. Hi, my name is Dr. Matthew Collins. I'm a chiropractor. I'm board certified in rehabilitation, fellowship trained in primary spine care, and we've been treating patients with the diagnosis of pinched nerve for decades here. Please remember, these videos are for informational and educational purposes only. They are not a substitute for medical or chiropractic advice, for diagnosis, or for treatment. So let's discuss this topic. Well, what is a pinched nerve? Essentially, it's a nerve coming from the neck or from the back that is compressed. However, we have discovered, as have a lot of other doctors, that a true pinched nerve is not that common. There are quite a few other conditions that mimic pinched nerves and can feel very similar. So I want to discuss all of these. So a pinched nerve, like we said, is a true compression of the nerve. But what are some other common conditions that mimic this? Well, one of them can be a jammed or a pinched joint. You see, inside of every joint of our body, in our hands, and even in our spine, there actually are nerve endings, and they can create pain that can radiate. So it's very common to see a joint that is jammed or locked, and it can mimic a pinched nerve. Also, joint itself can radiate pain. So just like a nerve going down the arm can radiate pain, a joint in the neck will radiate pain. Now, it's usually different. From an exam, we can tell pain characteristics. It can radiate down the arm too to some degree, but it's a little bit different than a pinched nerve. Also, you can have pain that radiates down the body from a trigger point. So muscles can develop hard, painful nodules. Those nodules, called trigger points, they can be active and they can radiate pain, or refer, pain is more accurate, to remote sites far away from where the muscle knot is. Also, you can have inflammation around the nerve. So a nerve may not be pinched in the neck or in the back, but it could be inflamed, and it can give you symptoms going down that entire nerve. So what kind of causes this? Well, it can come from a lot of different things. It can come from trauma, it can come from inactivity, and it can come from repetitive motion. Now, one of the challenges that happens with the spine over time, we're talking about more long-standing, not so much an acute trauma, but one of the problems that can happen over time is that the spine becomes stiff and tight. And the biomechanics, the movement of the spine, is supposed to work like a bicycle gear, or like the gears in a Swiss watch. They start to become jammed, stiff, and tight. So restricted joints can create inflammation. As the joints and discs degenerate, sometimes the spaces can collapse. That can create some sort of compression. Also, the muscles can become deconditioned, stiff, hard, and tight. You can create a muscular entrapment around a nerve, causing it to radiate, in addition to the muscles themselves developing trigger points. So what's really needed in a situation like this is a thorough physical exam. Can chiropractic care help with pinched nerves? Depending on the nerve, the location, and the severity, or the type of other surrounding conditions, for the most part, yes, chiropractic care can help. So if you're concerned that you have a pinched nerve and you're looking for treatment options, you can give us a call. You have a lot of videos to pick from. I'm honored that you chose this one. And until we meet again, have a blessed day.